you've mentioned three types of skin cancer: the basal cell carcinoma, squamous cell carcinoma, and the malignant melanoma. Can you just go through which would be the most likely to spread to other parts of the body, or which are more likely to stay local to the skin?
Sure. Basal cell carcinomas very, very rarely metastasize, almost never. It does happen, it's exceedingly rare. And certainly at the stage at which the vast majority of patients would bring the basal cell carcinoma to a doctor's attention, it has not spread. It has not reached that point. Reported cases of metastatic basal cell carcinoma are in patients who have left it beyond anything that we can even imagine. What it will do, the way that basal cell carcinomas can cause problems is they often sit in sensitive, problematic areas. They can be on an eyelid, they can be on a nose, and they can get into structures. They can grow down deeper, and get into nerves, get into structures that can cause problems.
And that would require further excision.
And that would require further excision. And if they're in the center of the face, theoretically they can track down the optic nerve into the brain, and that can cause issues even without metastasis. That can even cause mortality. So basal cells can cause real problems, but metastasis is usually not how it does that. Squamous cell carcinomas can metastasize, and typically, in most cases, in most healthy patients, they are slow growing, and it takes a longer time. Nothing in medicine is 100%. There are more poorly differentiated squamous cell carcinomas. There are variants of squamous cell carcinomas that do grow quickly. There are a category of patients called immunosuppressed patients, patients who are on medications that tamp down their immune system for whatever reason. Sometimes
they're more vulnerable to spread.
That are more vulnerable to squamous cell carcinomas growing quickly. And these are patients that should be followed very closely by a dermatologist, maybe every, especially patients who've had an organ transplant. Sometimes they'll follow them, several times a year with full body exams. And then there's I once heard a statistic that the mortality rate from squamous cell carcinoma is the same as that from melanoma, but there's so many more cases of squamous cell carcinoma that proportionally it's far less. And then there's melanoma, which is something which is a more aggressive type of cancer, where it's something that you really don't. We as dermatologists try to catch quickly. It's something that if we see it in clinic, we'll try to excise it that day, because these do tend to spread more quickly, tend to be more aggressive. There again, with melanomas too, there are different subtypes. There are lentigo maligna melanomas, which can sit for longer and without doing much, but there are nodular melanomas which can grow really quickly. But melanomas are aggressive cancers.
That's the ones that one has to worry about spreading.
Exactly. Exactly, and that makes up the bulk of when we talk about mortality. When we worry about mortality from skin cancer, that's melanoma is the bad actor that we think of.